Hi, this is Josh. I'm a pharmacist with pharmacisttips.com to talk briefly about Losartan. We're going to kind of cover some of the most common side effects that you need to watch for if you're using the medication Losartan. Real quick though, what is Losartan? It's an angiotensin 2 receptor blocker. Um, it's just the big fancy word for what it really is. What it's used to treat is high blood pressure, diabetic nephropathy. If diabetics with certain kidney issues can use losartan, and losartan can help slow the kidney damage associated with their diabetes. Certain people may take it to reduce their stroke risk with certain heart issues. Losartan has been shown to reduce the incidence of stroke. So we can see it used in those folks. What it does in the body, it causes the blood vessels to relax, essentially open up, just kind of that helps reduce pressure throughout the body, and then that reduces, of course, the risk of heart attack and stroke. In the US, it's sold under the brand name Cozar, or in combination with the diuretic hydrochlorothiazide, it's sold under the brand name Hyzar. Common dosages. The medicine comes in 25, 50, and 100 milligram tablets. Most people are going to start on that 50 milligram a day. A max dose considered 100 milligrams a day. If you've got some liver issues, you're probably going to be started on the 25, as you need a lower dose typically. It's taken with or without food, and then we want to take at about the same time each day, so we get a full 24-hour coverage for the blood pressure control. And it should be avoided during pregnancy as it is associated with birth defects. Most common side effects of losartan. Most people tolerate this medicine really well. By far, 9 out of 10 people would expect no side effects. Some things we can see: headache, dizziness, or fatigue. When you start any blood pressure medication, you want to watch out that it doesn't essentially work too well, make you feel lightheaded, faint, or dizzy. You want to be real careful upon standing or moving quickly, especially when you're first on it. You want to avoid getting dehydrated, as that can exacerbate those kinds of side effects. Some of the less common side effects, but we can still see those. Some people experience diarrhea, chest pain, low blood sugar, urinary tract infection, back pain, cough, and the cough can occur years down the road when you take it. So you want to report if you develop a dry, itchy cough on this medicine. Weakness and high potassium levels and other side effects can occur. Some of the more rare or serious side effects: angioedema. This we want to be careful for, especially on the first dose. It's serious swelling of the neck and face, and sometimes it can be so severe it can cause breathing issues. That, of course, is a situation where you would require immediate medical attention. Sometimes you can get severe allergic reaction. Again, medical attention should be sought. Severe rash. If you get like a full body rash, you need to get with a healthcare provider right away. Even though this medicine is taken to prevent kidney damage in diabetics. Rarely it can actually bring on some kidney failure. Extremely rare, but that's why it's important to monitor for side effects whenever you're on any medication. Just sooner we notice, sooner we stop it, the less likely the damage would be permanent. Muscle damage can occur, liver problems can occur, and there are other extremely rare side effects that can occur. So what about long term? What do we need to think about when you're taking losartan over the long term? Like I mentioned, that cough can occur. That can occur 3, 4 years down the road. It is less common with losartan than a medicine a group called ACE inhibitors like lisinopril and enalapril and captopril, but it still can occur. And so if that does occur, we want to get a hold of your healthcare provider and discuss your options with them. Otherwise, people tolerate it really, really well. But what we need to be sure that in the long term that we're monitoring liver function, kidney function, CBC, complete blood count, so we can make sure it's not causing any issues there. And of course, potassium levels, because this can actually cause an increase in potassium. And we just want to make sure that that is being monitored. Um, And so when you're on it long term, often we get comfortable with the medicine. We don't want to go in and have our labs, but these things can and do happen. So we just need to make sure on a regular basis we're going in and we're getting monitored to make sure all these things are where they need to be. So I appreciate you watching. I hope you found this information useful. Always, always, always talk to your healthcare provider if you think you're having side effects, if you're not sure. Um, just kind of keep those lines of communication open. Make sure you get your labs as you can kind of catch some of the side effects before they become serious. And subscribe to my channel if you appreciate this information. I would appreciate it. Thank you.